This is Mikael Nordfors with part 7 in my course in tendon attachment therapy. This one is about the knee, shank and feet. While watching this video, stop the video between each slide and try to find all the mentioned tendon attachments on yourself or the body of a friend. This will literally give you more of a hands-on experience. The first muscle is called Popliteus. It is involved when you have knee problems, and the origin is from the outer side of the lateral femur epicondyle. That means the side of the lower part of the thigh bone, the notch down there. And the insertion is on the inside of the upper tibia here, this whole area. The function is to rotate the tibia inwards when you're sitting, for example, when the femur is fixed. Or when you're standing, it rotates the femur outwards. So it has two actions. Here you see the origin better, just here on the side of the tibial femur condyle, here on the lateral side. And the insertion is here on the back of the upper part of the tibia. And here you see the Popliteus insertion. The next muscle is called Gastrocnemius and Plantaris, and they bend the leg on one part here, help bending the leg, and they also make plantar flexion of the ankle. Yeah, it makes you like jumping or walking on toes. And this is a very famous muscle, and the tendon is called the Achilles tendon. This where the Greek hero Achilles it was his weak point. And he was could not be hurt anywhere else, but if somebody managed to send a poisoned arrow here and kill him by just in this point, that's why it's called Achilles tendon. Here you see the origins of the gastrocnemius, and this is just on the back of the femur condyle here. And his plantaris a bit higher. It has the same function as gastrocnemius. Small muscle that joins the main muscle lower down and joins the Achilles tendon. And here's the lateral insertion. And then have another more deeper lying muscle called Soleus. Soleus and gastrocnemius are together called triceps cruræ also. And has the origin on the back side of the fibula and the medial border of the tibia, the soleal line. And it goes down to the calcaneus tendon. Here you see the soleal line, just below the Popliteus, and here on the back of the fibula. Of course, you can also always press these points and see if they are sore. Next muscle is called Tibialis Anterior. The origin is on the upper half and the lateral condyle of tibia, up here. And the insertion is on the medial cuneiform bones and the first metatarsal bones of the foot. The action is dorsiflexion and inversion of the foot. Dorsiflexion is the opposite, is an antagonist to the triceps cruræ, makes the toe go upwards and inwards. Here you see the origin, it's a big one, on the outside of the tibial bone and the inside of the fibular bone. And here you see the insertion. This is just under the foot on the middle here. Tibialis Posterior is as the origin on the inner rear parts of the tibia and fibula and the interosseal membrane, similar to Tibialis Anterior but on the back of the shank. The insertion is also on the inside of the foot. The function is extension and inversion of the ankle, moving the big toe downwards and inwards. So it's a partial antagonist to Tibialis Anterior. But they both do inversion of the foot. Here you see the origin more precisely on the skeleton here. On the lateral part of the tibia and the medial part of the fibula on the back side of the shank bones. And you see the insertion is similar to the Tibialis Anterior but a bit more towards the calcaneus here, and also on the middle of the foot here. This was Tibialis Posterior. Then we have the flexor digitorum longus and musculus flexor hallucis longus. They flex the toes, and they are very important for proper walking. The origin is on the posterior surface of the body of tibia and fibula, and the insertion is on the plantar surface on the base of the distal phalanx of the 4 lesser toes and the big toe, and the action is to flex the toes. Here you see the origin. You see here on the fibula it goes quite far down, and this is from the back. This is Popliteus, Soleus there, so going very low down here. And here are the insertions on the foot sole and on the toes here. The M.Peroneus longus and Brevis, they have the function of inversion and extension, plantar flexion of the foot. So they make the foot the similar action to Tibialis Anterior. Except the plantar flexion, it makes you go on toe and you turn the toe inwards. Peroneus tertius is a very important muscle. It has the function of eversion and flexion, dorsal flexion in the ankle, moving the outer side of the foot upwards, backwards. This muscle is often tense as a compensation for excessive external rotation for people with piriformis syndrome. They walk like cowboys, and you can see on their foot soles that the shoes are more teared off on the lateral side. And then you have to compensate this walking on the lateral side, cowboy walking, with tensing this muscle. Here you see the muscle origin. This is on the front of the fibula. And the insertions are here on the upper part of the foot, just in the middle here, where the metatarsal bones start. This is from upper, the dorsal side of the foot. And then we have musculus extensor, digitorum longus and brevis. And they are also very similar origin as the Tibialis Peroneus muscles. And they have the function of extension of the toes. So you move the toes backwards. Here you see the cross-section of the shank. Tibialis Anterior is here. Extensor digitorum longus and Peroneus longus. They are very close to each other. Soleus, M.Gastrocnemius, and here you see the extensor digitorum brevis. It's a short extensor. It has the origin on top of the foot on the calcaneal bone here. This is a very important point to press. And it goes to the dorsal side of the toes here to extend them. Flexor digitorum brevis is on the heel, under the heel, and it's very connected to heel spur, and it flexes. The insertion is here on the toes. And there are many other points under the foot. We don't have to learn everything in the detail. There is other therapy method called zone therapy, where you press all the points under the foot and they are supposed to be related to organ disturbances. You can see that many of these points under the foot are related to postural imbalances, and postural imbalances can definitely affect the organs. So maybe there is some truth in zone therapy. Anyhow, you see here are points, here are points, here are points, here are points, and here are points. All these points you can press when doing tendon attachment therapy. And that was all for today. Thank you.